without any delay. First slide, please.
Next, yeah.
So today we are going to cover inflammation, the gut connection, acute and chronic inflammation, microbiota associated chronic inflammation, the gut permeability, which is the most important, impact on dietary habits, how it impacts the inflammation, role of specific bacterial species, and case studies of Crohn's and UC. Next slide. So what is an inflammation? So let me just tell you some few basic things. All forms of immune reactions will lead to activation of the inflammatory defense system. So what happens is, it is a defense reaction of the body, whether you have an injury or also, so inflammation is like fire, inflame. It's like fire from the Latin word. So when you hit yourself somewhere, or you're burnt, or you're hit your hand or leg somewhere, so there is redness, there is swelling, there is pain, there is heat over there. So what happens is, these are how the body reacts to the injury that is happening. So when there is redness, there is an increased blood flow. When there is swelling, that is because of the accumulation of fluid that's happening. The pain is because of the swelling, and also the signal to the nerves because of the release of the compounds at the site of injury. So there are a lot of immune reactions, the inflammations, the fire that is started by the infection, the decomposition of the body tissue. So due to surgery, accident, and also autoimmunity or allergy, that is also inflammation. So in what happens is, in inflammation, microorganism where they should not be, that they are there. So just like in autoimmunity, the specific immune system attacks the body cells and tissues, and because of that, the inflammation is happening. But in allergy, where the food, the pollen, which is completely harmless for many of us, will be completely harmful for certain individuals, because in their body, that is perceived by their body as something that is like a danger, and this provokes the specific immune system to be activated against that particular food which they are allergic to, or the pollen. So inflammation happens to clear away the harmful agents, and it prepares the body for healing. It can be an internal factor like an autoimmune, or it can be an external factor like a particular food, dust, mites, pollen, etc. Next slide, please. So what happens when there is inflammation? And the process of inflammation is initiated, and there are a lot of 4 stages that are happening. There is danger cells. So in the tissue, what happens is, the dendritic cell, which is the neurons, these are the connections, these are the signals. When I said in the first slide, the pain that is being given, this is due to the dendrites, the dendrite cells, the mast cells. The danger signals are triggered, and there is inflammation which happens in 4 stages. What are the 4 stages? So first is, the blood vessels will widen, resulting in increased blood flow, which is the inflammation causing the redness and the increased heat. What happens when there is that increased heat and redness? The permeability of the blood vessel is increased, so that there is more outflow of fluid, plasma, proteins into the tissue, so that manifests itself as swelling. These white blood cells are recruited from the blood circulation like an army messengers. They are the fighters for the blood circulation to this tissue. They are mobilized into the blood circulation to the tissue, where they fight this inflammation or the infection. The metabolism is adjusted. So what happens, how it is adjusted, is increased levels of glucose in the blood. There will be fever, there will be fatigue, loss of appetite. All these will happen when there is inflammation, and the permeability happens in the body. Next slide. So what is an acute and a chronic inflammation? So nowadays, when the patients or the clients come to us, already they would have what do you say, looked at Google for everything, they will already tell that I have inflammation, I have low acid, I have, it is there for a very long time, I'm acute, I'm chronic. They throw a lot of words where they already would have Google searched, read everything and come to you. So that we need to know what is an acute inflammation, what is a chronic inflammation, how do you explain to the patient in a way that they understand about the body, so they know that they can trust your knowledge and you're going to give them the best care, the best nutritional therapy, so that they can be on their way to healing. So what is acute, what is chronic? So the intestine is the primary site of foreign antigen encounter. So after COVID, during COVID, everybody came to know how much immunity is so important for us, and it is the gut, the stomach, the gut lining, so the intestine, the whole thing, that is a primary site of foreign and antigen encounter. And more than 80% of our immunity lies only in these lymphoid tissue, which is the gut associated lymphoid tissue. And these are the lymphoid organs that are there primarily in the gut. This gut has that microbial colonization. We are basically trillions of bacteria. We are just bacteria. This is what. But from the beginning in our Charaka Samhita or in Indian culture, we have given lot of importance to digestion. We have given lot of importance to gut-mediated therapy, whether it is Ayurveda, whether it is our traditional way of eating. So we already know, before Hippocrates told that all diseases start in the gut, the Charaka Samhita is also given importance and said, yes, all diseases start in the gut. So the microbial colonization of the GI tract, it affects the way the lymphoid tissue, this is the way that the lymphoid organs, which is the primary first defense for us, is affected when there is inflammation. So when the process of inflammation is initiated by the body, it will proceed along a certain course of events until the inflammation is erased and the healing starts. So that is acute. But suppose if the cause of inflammation cannot be eliminated because of autoimmune like Crohn's or ulcerative colitis or lupus or so many autoimmune diseases that are there, or even neurodegenerative things where the inflammation cannot be eliminated, the inflammation will continue and it will often vary in intensity over time. So that is chronic inflammation, which is for a long time, where the body cannot get rid of that. And that is why the difference between an acute and a chronic inflammation that is happening. Next slide, please. So factors affecting gut microbiota is that associated. You can see that we have microbiota composition in different regions. We have in our respiratory tract. You're all qualified dietitians who's listening. Just bear with me if I just go through the basics. You know that there are trillions of bacteria in our skin, in our gut, especially in the oral cavity, in the vagina, in the respiratory. So everywhere there is trillions of bacteria that is there. And this is the one that is going to cause, that is regulating the whole immune system, which is happening throughout the body. And this is what is happening. Now, what is the, in a health, what happens? In a disease state, that what happens? You can see that the Treg cells that is there here. So the Treg cells and there is the Tef cells. So the Treg cells are the ones that are regulatory T cells. These are the ones that help prevent autoimmune disorders. And the Tef cells, they actually, the Treg and the Tef, they oppose and work, but for the good of the body. And they have opposing parts of the immune system, but they work together for the common good so that they maintain a balance in the body. So in a healthy state, you can see that the short chain fatty acid, there is a tight junction. There is no leaking or the translocation of the pathogenic bacteria or the bad bacteria that is happening. So everything is well modulated by the Treg cells, the Tef cells. There is the barrier function which is intact, and so on and so forth. But in a disease state, what happens is The tight junctions become loose. The pathogenic bacteria gets into through these layers, through the gut mucosa, the translocation happens and they come into the pathogenic bacteria, enter the circulation. And these are the things that happen. Macrophages are actually type of WBC which kills the microorganisms. So the macrophages are overworked and there is chronic inflammation and there is pathogenic bacteria into the blood. Okay, so now next slide, please. Now, what is this? Why there is an interrelationship between the gut microbiota, the inflammation, and what are the inflammatory conditions? So, what you eat, what are you susceptible to? That is why maternal nutrition is given so much importance. Breastfeeding is given so much importance because this sets our immunity for life, the breastfeeding. So the host genetics, the gene, the DNAs that we have because of our ancestors, because of our parents, our grandparents, and over the both sides, maternal and paternal, the host genetics, the age, the diet that we have, the abuse, the amount of bad things that we put in our body, antibiotic usage, maybe the child is falling sick very often. He or she gets a lot of ear infections, they fall sick very easily. Antibiotic is used without any what do you say, even for viral, because they have to attend an exam. So many things happens. There is too much of antibiotic usage when the child is growing. The female gender, the male gender, you can see in Crohn's and UC, where Crohn's, the female gender is more susceptible, 20 plus, 19 plus, the first early 20s, late 20s, the BMI, because of the inflammation, the more obese you are, the inflammation is more in the body. The mode of birth, yes, natural delivery. Then there is inoculation of the gut microbes, which is from the mother's vagina. The cesarean, it is not so much. Infant feeding, which is the breastfeeding, which is very, very important. The best gift the mother can give to the infant. So all these, what happens is in a metabolic syndrome where you have visceral fat, you're obese, and there is blood pressure, there is diabetes, that has a lot of inflammation in the body. Inflammatory bowel disease, which we are going to see in very much in detail. Yes, the inflammation is very high. Asthma, yes, it is an inflammation condition. Atherosclerosis, NAFLD, fatty liver is very common nowadays, grade 1, grade 2, grade 3. And of course, multiple sclerosis, which is also neurodegenerative. Now, what is LPS? LPS is, this is mediated because of all these conditions, which is the lifestyle diseases or neurodegenerative or an IBD. These inflammatory condition causes inflammation, which is already there. What is LPS? Which is a lipopolysaccharide. It is a component of the cell wall that is there in the gut mucosa of gram-negative bacteria. This will trigger an acute inflammatory response and give a gut-mediated inflammation, which has that inflammatory condition. That is why the gut microbiota, the inflammation and the inflammatory condition has such a relationship where it is. If you're obese, yes, you have inflammation. If you are a person who's susceptible to NAFLD, already you've taken, your visceral fat is high or you have fatty liver grade 1, yes, you have low grade inflammation. So these are the things that makes the LPS mediate that and trigger an inflammation in the body, and this rise to more inflammation. That is why you have a inflammatory response through the gut microbiota in your body. Next slide, please. So what happens? The gut microbiota is shaped by various factors, your BMI, your overweight, your obese, the visceral fat, how it is a bidirectional relationship. It is also a bidirectional relationship, you can see from the arrows. It depends on its composition. It can either inhibit, if you are lean, your body fat is low, and also it stimulates inflammatory pathways in the body. So that is how it can promote a various inflammatory condition in the body, and that is why it is not just you're thin, you're fat or anything. It is the body composition, it is the lifestyle diseases that can also trigger inflammatory responses. Next slide, please. So next slide. So the most established method of doing this for the gut microbiome is stool sampling. That is done many ways. The first thing is it is readily available. It is non-invasive. You have densely populated microbes. Even in the COVID-19, you can see that stool samples were taken from the different population, from the public health sanitary system for us to understand. So because it is, the microbes are populated and you get the correct luminal intestinal gut microbiota that is there in that. And this is how they do a PCR, they do a DNA extraction, they do the sequencing, and then they give the different microorganism that is present in the stool, whether it is pathogenic or beneficial or so on and so forth. Next slide, please. So how dietary choices impact the human health through alteration of the GI system. Now, protein, fat, carbs, we are all qualified dietitian. We have heard about these macronutrients. We know that polyphenols are good for the body. We want to have our pre and probiotics through food. And also this has a direct effect on what you eat on our microbiome, which is either beneficial or pathogenic, depending upon the food you eat. Now, changes in the bifidobacterium, lactobacilli, Akkermansia. See, what happens is Akkermansia is very, very good bacteria. They have found that in diabetes, in obesity, this good beneficial bacteria is so much low in concentration. But in a healthy microbiome, this bifido lactobacillus Akkermansia is very important, and it is help to increase the beneficial bacteria. This also slows down the progression of diabetes, obesity, and IBD. It slows the progression of gut dysbiosis. So Akkermansia has been studied very, very extensively, and it has also been given in the form of probiotics. It is very good for Akkermansia, and they have given it, yes, as supplements to the diabetes or obese individuals. I will talk about it. You can ask me definitely, Hina. I will talk about the diagnostic test also, definitely. Now, see this. What we eat, how it influences the gut microbiome. This has the cardiovascular disease, the diabetes, the obesity, the metabolic syndrome, the autoimmune. All these are triggered, as I told you, how the inflammation is triggered. And yes, what we eat, the genetics, the environment, the pollution, the smoking, the habits of the individual has a direct effect on the microbiome, which can be beneficial, which can be pathogenic and trigger it faster. So alters the host metabolism, immune system production. It can be pro-inflammatory, it can be anti-inflammatory. So everything is in your hands other than the genetics, which you cannot control. Next slide. So there is a lot of studies about the plant protein and the animal protein. And what they have told us, the plant protein increases bifidobacterium lactobacillus and decreases, which is the bad bacteria, the bacteriotides and the Clostridium perfringens. Now, when you have beneficial bacteria, it increases the short chain fatty acids, gives a good barrier, gut barrier, so there is tight junction, there is no leakage of pathogenic bacteria into the circulation. The tregs, which are these host cells, I already told you, these are the regulatory T cells, which helps to prevent the autoimmune diseases. But when you have these TMO, when you have more animal protein, you can see that Alice types, these are very bad bacteria, the Bilophila, the Ruminococcus, the bacteriotides. These are the things that are increased, which are pro-inflammatory. And this TMAO, which is also the way that it triggers this TMAO, if you have more This is the increased risk of first stroke in the body, and also the cardiovascular diseases, the decrease in short chain fatty acids, and this also triggers autoimmune, which is your IBD, if you're already prone through genetics and through your habits. Now, what happens is, it's not that we should say, no, no, everyone should be a plant-based thing, an animal-based. See, we are practicing in a way that we need to understand the person that is sitting in front of you and looking at nutritional therapy from you to heal their body with so much of other problems. So when they have come to you, you cannot be very rigid and say, become a vegetarian, become a vegan. We also listen to many people which says that, no, no, you're vegetarian, you need to have eggs. That is the best protein. It is not so. We need to definitely respect the person who wants to follow. He can be a person who's non-vegetarian but want to turn into vegan or to a vegetarian. A person who can be vice versa. They can be, but respect what they are feeling. Try to listen to them and then say the advantage and the disadvantage and let them take a decision. You can tell the pros and cons. That is how it works. Yes, animal protein has a lot of pro-inflammatory, which also does that. But you can give healthy fats, healthy protein through animal foods also. So listen to the client, listen to the patient, listen to the person who's suffering these chronic inflammation and give them the right solution where they don't think that it is a punishment for them to follow the diet. One of the social media I saw last week, and I was a bit like, why do they do this? Because one was commenting that do not go to a dietitian. They always say that avoid things, avoid, don't eat this, don't eat that. We are not so. We understand the client better. We understand the different diseases. We are the ones who need to understand. If you go to an ICU or a ward or a client, we look at diabetes, we look at liver problems, we look at neuro, we look at other things. We learn the whole gamut of things, and we are not saying we are super specialists, because food as such has a lot of influence on preventing a disease, causing a disease, causing inflammation. So we need to understand the client. That is how personalized nutrition works. When the person sitting in front of you, you be a good listener, give them the pros and cons, make them understand their body, make them understand the symptoms, let them take an informed decision. 1 second, sorry, battery server. Yes. Next slide, please. So impact of dietary fats, unsaturated fat, there are polyunsaturated, MUFA, PUFA, everything. You can see that avocados, olive oil, we have our own kachigani mustard oil, we have our sesame oil, we have lovely oils in our country itself. Coconut oil, MCTs, yes, everything in moderation. You can see that beneficial bacteria goes up. And if it is too much of saturated fat, then yes, it is bad for and triggers inflammation, gives rise to atherosclerosis. But when you have good fats, you can see that the species, the genus of the good bacteria, the beneficial bacteria increases in our body. And you can see that Faecalibacterium prosnitzi has been studied in such an extensive way that for diabetes, and it definitely increases insulin sensitivity in the body. So you can look at people when they come for pre-diabetes, what to give the right way in the food or the probiotics in a way, and then we can see that it increases insulin sensitivity. I just want to tell Salome ma'am and PNA Life that, ma'am, there is a lot of things which we can learn, or you can please suggest where probiotics can be one topic where each species in what dosage it should be given and what condition it should be given. There is a lot of literature out there. So maybe one of the topics, if you could host, it would be very nice, ma'am, because as qualified dietitians, more and more literature is out there, and we need to know not just generally probiotics, prebiotics, but for a sports athlete, for a clinical condition, for a neuro, what species to be given, what dosage should be given, what months, how many months to be given. There is so much of literature out there, and it will be very beneficial for all of us. Thank you. Next slide, please. So popular diets, what happened when there is a Western diet? There is a lot of, it is also called as the sad diet, where the beneficial bacteria comes down and this goes up. The pathogenic bacteria goes up. Now, what I want to stress here is healthy subjects, when they are on a gluten-free diet, not a celiac, not a gluten sensitivity person, but a normal person, a healthy subject, if he or she is on a gluten-free diet for 30 days, there are studies which says that the good bacteria comes down in the body and the bad bacteria goes up. So gluten-free diet is not for everyone. We should also not jump into the popular vegan and say, no, go lactose-free, gluten-free. Already when they come to us, they're already into all these things, fat diets. We should understand that no, unnecessarily, we do not need to put gluten-free diet on anyone and everyone. And Mediterranean diet, yes, it has very good beneficial effect. It is always every year when they say top diets, Mediterranean and DASH diet comes number one from many years, for decades now. So when you have good diet in the body, the Mediterranean diet or the DASH diet, or any diet, a balanced diet with more fiber, more polyphenols, all the food groups which is there, it decreases inflammation, it helps control or prevent diabetes, and yes, prevent diabetes, obesity also. Next slide, please. So now I just want to say that the bacterial species which is there, some example of bacterial species where it is says that the green ones are the beneficial ones. These are likely to have a positive effect on the GI channel, on your gut mucosa, successfully used as probiotics. But when you see the red species, which is with the red arrow, these are the ones has possess the pathogenic potential. They weaken the gut barrier, they destroy the gut mucosa, and they have a very inflammatory response. How it happens is the leakage, when we say the translocation of the bacteria happens, the gut barrier is broken down, and these pathogenic bacteria of the mucosa, the leakage of the bacterial components end up in the liver. That causes the inflammatory mediators and cause an inflammatory response in the body. Next slide. So gut permeability is the most important. The tight junctions are the one that helps you to not have inflammation, prevents IBD, and that is why what we eat, the genetics, the lifestyle, whether it is smoking or drinking or having high fat, pro-inflammatory foods. There is a saying that when kids come for childhood obesity or even for other, like a colitis, there is, because everything is in the tip of your fingers, they say that you just do it 2 minutes, that somebody will ring your doorbell. But is it a good doorbell? I don't know, because people do not want to wait for that sweet or that particular thing which we have festivals. We know that we have Ganesh Chaturthi, we know that the modak is there for us to eat, but nowadays everything is available, like even the fruits, it's no more seasonal, everything is available throughout the year. And also the pro-inflammatory, it is just the tips of our fingers and everything is available. So what happens is too much of saturated fat, processed foods, everything in packets, all these trigger an inflammatory response, and the growing child has stomach infection or even colitis very often because of this. And this gives rise to childhood obesity, and maybe genetically he or she is prone. And these repeated colitis, when they live in a hostel or in the college going age or an adolescent age, because many people go for studies, different states to study away from home, and when they don't have control over their food because of the PG or the hostel or something where they're forced to eat, so all this builds up, and by the time they are in their early 20s, they land up with an IBD. if they are more prone to it genetically. So the gut permeability, mucosal inflammation has such a thing. And you should not think, okay, when the mother comes or the parents come, I don't want to genderize, when the parents come and they say he eats too much of junk, she eats too much of junk, or sometimes they will also comment that, no, you should not avoid all the time, or please ma'am, let him have more sweets, he loves sweets, he has a sweet tooth. In this age, if he doesn't eat or she doesn't eat, which age she's going to eat? So that is not how it is. It is over the years, the body is a wonderful oil machine. It is the way you treat it, it is going to treat you back, because it has a lot of inflammation mediators. And this is how you prevent through good diet, good lifestyle, good values, where the parents are the role models, the grandparents are the role models. If everyone eats healthy at home and occasional indulgence, it is not going to affect. But if it is pro-inflammatory all the time, and then that is what is going to cause them to have IBD later on in life, if they are genetically prone. Next slide, please. So mucosal homeostasis and gut permeability. Now what happens is, when we have these pathogenic bacteria which weakens the barrier, this is the one that the body digests the nutrients, they have it. If we are going to have a sad diet, a more westernized diet, everything that is ultra processed, it is going to compromise on the gut permeability. So the mucosal homeostasis is compromised, and there is more of colitis, IBD, IBS types of issues that happens. Next slide, please. So the inflammatory diseases, you can see, you can look at this paper. It is very, very nice. Immunological mechanism, there is a lot of how the inflammatory diseases happen because of the gut dysbiosis. And this is how the immune system dysregulation happens. And you can see that even, next slide, please, you can see that the gut and the brain, where it is, no, immune system dysregulation, when it has happened, everything is bidirectional. That is why the gut is called as the second brain. And when you have, even for Parkinson's, there are a lot of papers which says that 6 years, 8 years before the first tremor happens, you can see the dysbiosis, you can see particular species, the pathogenic bacteria, and you can say, yes, this person is prone to Parkinson's. So there is a lot of neuro connect which is happening, and you're more prone to these immune system dysregulation. Next slide. An unhealthy lifestyle, genetics will collide to trigger IBD. The too much of processed foods, the too much of instant gratification, the average salt intake in an Indian population, which the ICMR released almost a year ago, was 10.4 grams. And you also know that WHO advises 5 grams. So the salt intake is very high in our population. And yes, Indians love sweets. That is why from your toothpaste in the morning, it starts, we are people. Sugar, they say kapi is an emotion. Sugar is also an emotion. And when we say celebration, it's always with sugar and sweets, of course. Next slide. So pathogenesis of IBD, it is not just the genetics alone. It is the environment, the urbanization, the way you eat that causes the immune dysregulation. The beneficial bacteria come down, the gut dysbiosis happens. And over the years, when you take all this, that is how it triggers, because you have a genetical makeup. That is why the inflammatory bowel diseases are triggered and the inflammation causes it. Next slide. Now, this is a case study about a 26-year-old man. He comes to the emergency department with severe pain, the lower quadrant abdominal pain, abdominal bloating, distension, intermittent mild diarrhea. 8 to 10 months he has suffered with abdominal pain, low-grade fever on and off. They have said stomach infection. He has taken many antibiotics. He's gone to the hospital for 1 or 2 days stay. Over the years, for 8 to 10 months, almost a year, he has suffered. You know that people, as we love to try to self-medicate ourselves. We try to do many things, but only when it becomes chronic, we try to go to the doctor, which should not be so. So there is that also. The other thing is intervening. In this 8 to 10 months, it's not that every day he had it. You know that he had some asymptomatic periods for a couple of weeks, couple of months. Suddenly it will trigger. He'll have diarrhea. Sometimes it will not be there. So he thinks that, okay, I'm not tolerant to milk. He will go lactose free. He will go gluten free, but nothing. He's confused. One time he eats the same thing. Sometimes it affects the same thing he eats after a month. It doesn't affect at all. So he's completely confused what to eat, what not to eat. These symptoms start at the same time he had his job outside his home state. He's 26. He got a campus interview. He was living alone out of this home state for some time. Then he thought, maybe I'm eating too much outside. That is why it is causing all this. I'm getting these stomach infections. He had a 10-kilo weight loss, unintentional, of course, in the period of about 8 to 10 months. Next slide. Now, Crohn's disease as such, when you look at the histology, you can see that these lymph nodes sometimes also has granulomas. And when there is a lot of neural hypertrophy, you can see the arrows that is there in the mucosal area when there is an active disease in the finding. So when they do these things, you can see that Crohn's and UC are both IBD, but completely different. But they have certain common things, and I will tell you what you should give for what in the form of a diet, and you can ask me question. Next slide, please. Yeah, so they were doing blood tests. They were checking for inflammation, infection, internal bleeding, what are the different vitamins and minerals. So antibody tests were done. His CBC was normal. Vitamin D was low, but the calcium level was normal. The iron profile was normal. Yes, the CRP was elevated. The ESR was elevated. Only when certain times when he's gone through those stomach infections, the so-called stomach infection, colonoscopy, of course, was done, and to see where the inflammation is and which part of the intestine that is affected. Next slide. Yeah. So when the CT scan is done, you can see that the dilatation of much of the small bowel, that is, in this case, for him, he had an obstruction which caused a lot of intense pain. That's why he came to the emergency with fever and other thing. Usually in a Crohn's, the distal ileum is the one that is always has a luminal narrowing. They have strictures. That is why they say with seeds, especially popcorn, corn, seeds, anything like a guava with big seeds, flax seeds, pumpkin seeds, they just don't tolerate any seeds because they have strictures where it is just closed. Like when you see a person who has taken corrosive acid, you see that esophagus becomes a stricture and the liquid doesn't go through. Like that, there is stricture is very common in Crohn's, and it is usually the ileum. There is a luminal distal ileum that is affected. There is narrowing of it. There is a string signs, and you can see how it is affected. Next slide. Now, in a normal intestine, you can see how smooth the surface of the gut mucosa is. It is a normal wall. But when you see there is a Crohn's, it is very easy for them to develop a fistula. Because of the stricture, the body develops a fistula, and the thicken the wall, the gut mucosa in the terminal ileum, usually that becomes thickened, and the fat, there is too much of fat wrapping over there. You can see all these yellows over there, and there is a cobblestone. It is so much like you see in the cirrhosis of liver how there is nodules, like that here it is like a cobblestone, like intestinal surface. It is not smooth like in the normal intestine. This is Crohn's. Next slide. So when clients come to me, usually what happens when they approach Mitahara, they would have tried many things. They would have done the colonoscopy when they say it is Crohn's. Over the years, they would have taken steroids, what the doctor has prescribed, and they would have taken immunomodulators. When they come to that immunosuppressants or the biologics, the doctor will say, we'll wait for a year, we'll wait for 8 to 10 months, we'll see how you're doing with these steroids. If not, then you have to go to, if you're not on immunomodulators, you have to go to biologics, which is basically the immunosuppressants. Then what happened, whether they live abroad, whether they live here, they get very scared, because yes, definitely it is, we have to acknowledge it is very scary to be in an immunosuppressant, unless you can see, you would have seen a lot of transplant patients where they have to be on immunosuppressants, and it is very easy for them to catch infections or anything. So when you have an like a Crohn's or a UC, and they have to go into severe biologics, when they say that, immediately they try to heal through food, and they come to qualified dietitians like us, and they say, ma'am, can you do something? I don't want to be on immunosuppressants. Next. So there is a CDED, which is basically a Crohn's diet, exclusive diet, an elimination diet, which is there. You can exclude, you already know FODMAP, I'll touch on that also. It excludes wheat, it excludes dairy, it excludes animal fat, additives, processed food, red meat. It says that you have to have polyphenols, vegetables, fruits, rice, potatoes, easily digestible food, resistant starch. You have to give the correct energy for them to sustain. All these we know. But all these are theory. When it comes to the person who's sitting next, coming to you to find solutions for their condition, then you need to be you have to micromanage their plate, what they put in the mouth. So next slide. So there is also an autoimmune protocol diet, where is an anti-inflammatory diet. It focuses on staged elimination of grains. That is what they say. Legumes, nightshade vegetables, sugar, of course, dairy, eggs, nuts, seeds, processed food. What is there to eat? Everything you have said, avoid. Then they're completely more confused. Lean protein, fruits, vegetable, yes, adjusted as needed. But when you say that don't have grains, don't have legumes, don't have certain vegetables, then what do they eat? India is primarily cereal eating country. Wherever you come from, it can be a ragi in Karnataka. North Karnataka eats a lot of jowar. They have jolada roti morning, afternoon, and night. Ragi is there, which is very, very healthy. In certain parts of Karnataka, you know that North eats more of bajra. We have very good millets. We have different wheat. And in the South, yes, we have red rice. We have different ancient rich grains, which are so good. And we have, yes, primarily rice eating. I'm from the South, so rice eating. So when you say very easily elimination of grains, psychologically, it should also be satisfying for them with pain relief, with goals which you set for them to not have, flare-ups. So the goal is to reduce what contributes the dysbiosis, what contributes the inflammation, and definitely bottom line here is tolerance. Whatever you give to the patient or the client is intolerance to the food should not be there. It is not just one size fits all. That's why they have come to you for a qualified dietitian, to understand their body, what is suiting them or not, and not just Google. Improving other lifestyle factors, where we have to tell them, many people of these gut things are type A personality. Sadly, sometimes they would have, women as such, young women, they would have gone through abuse. You have to listen to them. Half the times we are psychologists also, we listen to them patiently. We need to understand them. Yes, they are type A personalities. Stress, sometimes too much of stress. Stress is very loosely used, but actually so much of stress as women living in the country. There are so many things that they face, and we need to see how much of pressure both genders when they are studying, how much where they don't have access to good food, healthy food. We have to understand that if they are in a hostel. Physical activity, how much is possible. Social connection is so important, because that is where they get relief, or we need to respect what they are going through and then try to advise. Next slide. Give me 10 minutes, I'll finish. I'm sorry, it's 5 o'clock already. So the anti-inflammatory food, different colors on the plate. So if you're using a capsicum, it can be a green, yellow, red. You can use the same thing in different colors. If it's a cabbage, it can be a thing that where it can be a different colors where it helps. Next slide. So how do you monitor the food dairy? The food log has to be monitored, the blood test. The fecal calprotectin is done for both UC and Crohn's. And this is how, where if it is less than 150, it is considered normal. And if it is more than 150 or 250, even sometimes it is more than 4 digits, they come to me, then definitely they go for colonoscopy. Immediately colonoscopy is done, because if it is, they need to know what type of IBD, is it ulcerative colitis, is it Crohn's, and then they do it. You look at the quality of life, they're so scared to eat outside, they're so scared to travel, weight changes will be there, bowel habits, they always run to the loo in a meeting, they are very scared to know what to eat, when to eat, how to eat it, because the texture really matters. Mental health, stress and anxiety, this itself causes a lot of anxiety. And use of supplements, they already take collagen, they think they have SIBO. One person came to me, he said that I have SIBO, I have low stomach acid, I'm already taking collagen, I'm on a lactose-free, gluten-free diet, I take omega for this, I take this, and he's giving me so much of thing as if he's already qualified and he's read everything. And then he told me, these are the supplements, this is what I want. And so we as dietitians qualified, we need to understand and try to answer all their questions and also tell them this is what it is. And we need to know the blood test and things like that. Next slide. FODMAP, yes, many of us have taken FODMAP course. It was developed for people with IBS. Then it does reduce symptoms of IBD, but it does not. There are several studies which says that it has not been shown to reduce inflammation. It reduces the symptoms, but not the inflammation. Next slide. So anti-inflammatory diet, well cooked and steamed and boiled. So diet plan. So when I try to do this for them, what happens is they said that, okay, this is what I'm planning for you. This is what I'm going to do this for you. Anti-inflammatory, I'm going to give it to you, but it is going to be well cooked and steamed and boiled, nothing raw, nothing with seeds. You have a stricture there. The protein sources of lentils, dals, legumes will be there. I'm going to start with a lactose-free and a gluten-free because he or she will have intolerance. In this case, it is a he. Prebiotics, more like because the person was given more of an avial, we share recipes. Nendram is a Kerala banana which has resistant starch. Draw banana, recipes were shared how to do it in a well-boiled way. Vegetables with curd, gravy, cooked of course was done. No probiotic supplement was given because many studies say that Crohn's should not be given probiotics. You see, yes, ulcerative colitis, there are a lot of probiotic supplement has been recommended, but in Crohn's it is both more of papers which says not much probiotics has beneficial effect on them. So I was not giving any probiotic supplement. Personalized nutrition to understand the body. Gluten-free flour for this patient triggered loose stools. So gluten-free flour as such will have, so it can be an almond flour, it can be a thing, but there are instances where the gluten-free has triggered loose stools for many. So method of cooking, pressure cooking helped to tolerate better many foods. Microwave did not help because it was getting dry. Ayurveda says every plate should be 1/3 of the meal should be liquid. So it is better to have liquid with along with that, especially in IBD. Online follow-up was done even when she went from the hospital. There were flare-ups on and off, but we made her understand her body and then how to manage it. Depending on her regional roots, we try to give them the food so that they are very comfortable with that and the body also accepts it better. Next slide, please. So in UC, this is about a 28-year-old woman, a working professional, had a mild abdominal discomfort and cramps over the Past 6 weeks associated with diarrhea and passage of bloody mucus. That is a important thing where you see mucus in the stool. The diarrhea was typically nocturnal, or whenever she had something, she had to run to the loo. She was a working professional, so she had to take a break from her meetings and other things. And this really upset her because she's a young woman who studied hard to come to this position. And then she's running to the loo in a meeting. So she didn't know what to eat or what not to eat. Next slide, please. So no hemorrhoids are seen when the GI surgeon is looking at it. Only the digital rectal examination showed bloody mucus. C. difficile was done. Then stool culture was done, which was negative for parasites, but her CRP was high. Her calprotectin was on the 4 digits. Next slide. So the colonoscopy, what showed is markedly inflamed mucosa beginning at the rectum. Usually you see it is usually in the terminal end. The rectum is the one that has a lot of bleeding. That is why they are on mesocol, medicated enemas. So every day they take 2 times, 3 times they do it. So you can see at the rectum how extending it is continuously through the sigmoid colon and also the distal descending colon. It's completely inflamed mucosa. The remaining colon is what? Without lesion, and also the biopsy was performed. Abnormal mucosa were there and also some normal mucosa, but it's usually the rectum and the end of the distal descending colon that is usually inflamed, and they have a lot of issues. One more thing which I want to tell you is in an IBD, they will try to give steroids, they try to give you on immunosuppressants. Why? They have, IBD has a very increased risk of colon cancer. 10 years down the line, 15 years down the line, the inflammation, the autoimmune, the triggering. So they have a very high risk of colorectal cancer. That is why the inflammation should be controlled. The body cannot keep attacking itself. It's not just the symptoms alone, but they have a high risk of colorectal cancer. Next slide. So what are the UC character? Typical involvement is beginning at the rectum. Almost always it is involved, extending proximally in a continuous fashion without skip lesion. In a Crohn's, the transmural, it is the whole gut mucosa where some parts will be there, some parts will be normal, some parts again will have something. But in this ulcers, usually it is distal end. Ulcers are diffusely present, transition, it is there. It is typically quite abrupt and in the rectum. Next slide. So what is, you look at the histology of it, what you saw in Crohn's, what is there? There is a distortion, irregular shaped branch glands. You can see how there is inflammatory cell component that is come. It is coming into the submucosa. You can see we need to understand the pathology. We need to understand the biochemistry. We need to understand what is happening so that we give nutritional therapy in the right way. Both are IBD. Next slide, please. So you can see the difference between the Crohn's and the UC. The location is ileum and colon in Crohn's. Usually it is always rectum and the distal end of colon in UC. Skip lesions are there, but here it is continuous. Fistula formation is very common in Crohn's, but ulcerative colitis is rare. Strictures is very common. In ulcerative, it is very rare or none at all. Bowel wall is completely thickened with creeping fat, but bowel wall is thin. There is no creeping fat in UC. Next slide. So what it is to personalize nutrition with regional roots has to be given. This the 26-year-old professional was a North Indian, so we gave a lot of well-cooked, more soluble fiber with North Indian based, what she's used to eating. So she had confidence in eating it, cooking it. She was tolerating lactose, so it was not just anything. So she was given milk. Gluten was gradually introduced. She tolerated better because she's used to eating chapatis, fulkas, paratas. Of course, we had certain way of giving that gluten, and constipation was on and off with bloody stools. So we tried to make sure that the wheat was only once a day and not 3 meals, which she's used to. Choose your vegetables and fruits with no seeds. Tolerating fish and egg whites, so we had introduced it 3 times a week. Gradual weight gain was there, frequent follow-up, and probiotic supplements were given. Next slide. So what the conclusion is, there is a symbiotic relationship between gut microbiota and the immune system. This play a crucial role in maintaining intestinal homeostasis and suppressing the inflammation. We need to make sure that from the beginning, the colitis, is there an immune dysregulation? Are they genetically prone? What are the pro-inflammatory factors? Disruption of the normal immune homeostasis of the intestine will have an abnormal immune response. This will rise to inflammatory diseases. So in these, because of these findings, whether it's calprotectin, whether it's colonoscopy, whether therapeutic intervention should be there to solve as much as possible the gut microbiota dysbiosis, give them proper dietary modification, functional medicinal therapy, administration of probiotics, prebiotics in the form of food or in the form of supplement where necessary to manage these chronic inflammatory diseases. Next slide. Thank you so much for patient listening.
Thank you, Sreemathy, for that excellent.
Thank you, ma'am.
We'll take few questions, Richa. If there are any
Yes,
questions,
ma'am,
we'll
sure.
take it and then we'll conclude.
First of all, I'd like to congratulate Sreemathy ji. It was a very engaging and very insightful session. Always look up to your sessions like this because gut inflammation is a core of all the disorders or diseases, and we need to understand as qualified dietitians how to deal with them. There are quite many questions in the chat box. We would start with the question that Hina asked about supplements for Akarmentia that you mentioned earlier, and are there any diagnostic tests for IBD? She would want to know both.
Okay, so see, when you nowadays companies are coming with personal probiotics. There are companies which are startups which are there. Yes, we all know they do the stool, but there are personal probiotics that are. It is not still in full swing, but there are combinations which are there. So we need to not just say take a probiotic supplement. We need to look at the different species, the billion amounts that is there, and see the CFU, and then do it. Yes, you can look at Buladi, you can look at Bifido, you can look at Lactobacillus, look at supplements that also has Akkermansia, and then try to give it if at all it is there, and then try to do it definitely. Yeah.
Are there any specific dosages that one needs to consider while doing prescribing?
Yeah, so what happens is, this is an entirely different topic, Richa, where every species, there are a lot of papers where we can make it into a lesson plan or a module map, where it is, you can do it for every species, what condition it can be used, how many months to give, and how many months. So many each one. So when I say that Akkermansia is also for diabetes, it's also for obesity, this one. So we need to see in what with supplement. It cannot be only that. There are different products that are available. We need to see it and what is the dosage, and not just see a blanket thing, because we need to see what product is out there and which is too much also. But at least we can't see just the product and design. We need to see the condition of the patient, what is the scientific evidence base that is available, and then see what are the combinations that is available. Definitely there will be a bifidobacterium, lactobacillus, and a Buladi. Okay, this Akkermansia, what is it? Is it coming separately along with the commonest? What are the things? And if we look at the papers, what it works best with the other probiotics. When it is in symbiotic, which is added, because there are a lot of things out there.
And like rightly put up by you, I think we should have a separate session for probiotics and to understand these things in more detail, because like you said, it is quite advanced, and this is just the basics that we spoke about today. So we should have a separate session if ma'am also will agree with what
We'll
Sreemathy
only have,
was saying
if
earlier.
Sreemathy agrees, we'll give her only. She'll be
Sure,
glad
ma'am.
to take it, I
I'll
think.
be honored.
So,
Thank you so
as
much.
we plan
Too much
the session,
discussion.
yeah, we because
Ma'am,
we
what
have
about a blood
series
test,
of
ma'am?
sessions planned for the year. One May series of sessions we do plan for the year. No? So the inflammatory sessions are going on, so we can have one or two sessions with those modules. Thank you so much for
Sure,
suggestion. And Hina's question, I think Sreemathy has already addressed. It is fecal calprotein test. That's what you want to know, no? IBD.
Yes,
Hina,
ma'am.
tell me, Hina.
Fecal balloon.
Yes.
Yes, ma'am.
Self-protect. Yeah.
Calprotectin. Yeah. Next
Okay.
question, which is there, ma'am, that you mentioned about animal protein has pro-inflammatory factors. So should egg also be considered in this category? I think she mentioned earlier about this. If you would like to mention, how would one be able to manage even proteins for these patients then in that case?
So, see, we cannot give a blanket thing where a person is used to non-veg from the beginning. Yes, plant-based solutions are there. Maybe you can give it in a way where there are animal protein which are not low-inflammatory species of fish, and eggs are, which is the egg, and that can be done where we can try to understand the person that is sitting in right in front of you and then do the correct way of recommending that to them. So we cannot give a blanket statement. Yes, red meat, yes, organ meats are pro-inflammatory. That can be there, but there are a lot of animal protein also. So leave the decision to the thing and say if they want to be a non-vegetarian, give them that are least pro-inflammatory and suggest more plant-based sources with polyphenols, more color, more anti-inflammatory in the form of vegetables and fruits, and give them that solution.
Okay. So there is one more question which says that how to decide which type of diet to be advised, whether it has to be a low FODMAP diet that needs to be advised, or is it supposed to be your anti-inflammatory diet? How one needs to understand which protocol to be suiting to which kind of patients.
Okay, so this is not a blanket thing. So I'll give an example. When they say onions cannot be given in a FODMAP, how it is there, right? Yes, the onions has where they have the cramps, where it triggers their intolerance, everything. That same onion, first you understand the body for the first 2 to 3 weeks of that person. See their stools, see the frequency of the stools, see when they are doing it. And if they are tolerating the basic khichdi, the resistant starch, the way well-cooked things like an 8-month-old, you're giving all that for 2 to 3 weeks, then you introduce these onions and other things, which is also what the FODMAP is saying. Don't give them an elimination diet for too long, try to reintroduce it. So for an example, when I'm trying to introduce an onion, what I say is not even grated in the carrot grater. Do it in the garlic crusher type of, in the same grater. There is one way where you grate the carrot, it comes as thin, but on the other side, it is like more thorny, where if you do it, it's more like a garlic crusher type of, what do you say, it comes out more like mashed potato kind of thing, and it is more of water comes out. If you add that to the oil or the first time when you're doing the onion saute, it is tolerated.
It is well.
But when you try to cut it, however fine you cut it, it triggers a response. If you carrot grate it also, it triggers a response. But so as I'm also a dysphagia, texture really helps in IBD also. It's the same thing when if you tell me that a boiled potato, if you boil it in the thing, but if you pressure cook that sweet potato, and remove that thing and then put a jaggery syrup on top. That is the traditional way of giving a sweet potato. Where it bursts open and then you can see the big like that. It is well tolerated. But when you grill it, that is also one of the recipes in a sweet potato. It is not tolerated. Well-cooked foods are better tolerated. So the way you advise the same onion, the same garlic, the same thing, see the body, how it responds, whether she or he gets a cramps, they run, or the frequency of stools is reduced. And so FODMAP, anti-inflammatory, all these are only theory. Anti-inflammatory, the same red capsicum, yellow capsicum, green capsicum, the capsaicin, if it is boiled and pressure cooked or steamed and given, it is better. If the sprouts as such, then it is steamed or well boiled is better than that. So it is what we are reading is basically theory, CDED, anti-AIP protocol, FODMAP protocol, all these are theory. But a person who is coming from south, east, north, west, wherever they are, 100 miles, we have a different cuisine. We need to know how a Maharashtrian eats, how a South Indian Tamilian eats, how a Kerala person eats, how a Telugu eats. You need to know their dishes, what goes into that. A pulisu, an avial, a red rice. I went to Thailand 2 weeks ago, ma'am. The black rice pudding, the karuppu kavani, I put it in my Insta also. Amazing is not the word. It's so well that kheer, they've made it with coconut milk. It is so good, made with coconut milk. So well boiled, even an 8-month-old could have had it. A Thailand way of doing Thai cuisine. But it is there in our own, the karuppu kavani or the black rice. Whether it's in Assam or in South India, it is there. So you need to be so personalized that they come back to you because you handhold them. So it cannot be a generalized that they get it in Google, they should not come to you.
Right, absolutely. Very well spoken about the same, that you need to understand the patient's tolerances, the patient's cultural preferences, what is the patient's taste, or what is the patient's preference, as we know that it changes from area-wise, from culture-wise. So we need to consider, and we need to take a detailed history of the patient and the history of the family also. Because what do you think how the counseling has to be when it comes to these kind of patients? How much a family also needs to be involved in these kind of consultations and counseling?
100%. This is the most important. The history taking, the first initial consultation takes minimum 1 hour, 45 minutes to 1 hour. That is blocked. How it is I'll tell one example if I have time. I had an obese gentleman who was 120 kilos. He had everything. Yes, obesity, inflammation, diabetes, everything. Yes, diabetes became controlled. All that is there. But his weight did not move even 1 kilo here and there. 500 grams he would lose, but again, come back to that. 500 grams he lose. He was following it to the T because every day the plate, breakfast, lunch, and dinner was coming in my WhatsApp. And I know that because of his all the gadgets, how many minutes he's walking, his personal trainer, everything, he was doing it to the T, but it was not moving. Maybe 500 grams it was moving. But so I couldn't even tell him, you're not exercising, you're not doing it. But one day I noticed something here and I asked, what is it? What is going on? He said, this is the skin doctor told me, the psoriasis. I said, you didn't tell me when I took your history. No, ma'am. When I was very young, I had psoriasis, but it went away. They said it was psoriasis. I was less than 5 years old. Then it is. Then when I did an autoimmune and then I did it, now he's 93.
Okay.
So the autoimmune plays a huge role, history taking. We are detectives. The body is trying to tell you something. One-sided headache is telling you something. The cramps is telling you something. Constipation is a big no-no, even if you don't use the loo once a day. I had a client who didn't use the loo for 1 week, and it is very common for them. And taking a psyllium fiber, no, I don't want you to take anything external. Body is a wonderful oil machine. It can move by itself. It can evacuate. It can tolerate. It can do anything. We are detectives. We are trying to find out solutions through food, not through supplements. And don't go by popular thing, unqualified or influencers that say, oh, this is great, that is great. No, you look, for example, POP. When I say, we know in Ayurveda, the peel of pomegranate, which is the white one that is there, it is boiled, and when you drink it as an infusion, it's great for the gut mucosa. But can I just say, no, you do this? I have to go to Harvard PubMed and see what it is. It said POP. It said POP with a capital P, a smaller O and a big. So it looked very cute, POP. And I'm like, what is this POP? It was peel of pomegranate. And there were so many papers which says it heals the gut mucosa. Now I'm convinced. I'm going to tell them, drink a peel of pomegranate pop water, 50 ml 3 times a day for your gut mucosa. So we have to find out what is the thing, find solutions for them, and then try to do.
Unless we are convinced about it ourselves, how can we convince our clients on it or our patients on it? And how can it be more effective then? Do you have any say about micronutrients here? Since it's a gut inflammation and it's mucosal inflammation that we're looking at, what about micronutrients? Are there any specific things to be kept in mind?
Yeah. So when it comes, because Crohn's, young girls are more prone to it, young females are more prone to Crohn's, what happens is anemia is very common in our country, and you can see the iron profile and the Crohn's that is there. Even in UC, iron is very low because of the bleed that they get. There is a lot of mucus in the stools, and they have these pink streaks or they have blood spots. So the anemia is very common. So you have to look at their iron profile. You have to look at their hemoglobin and micronutrient. Vitamin D is a given. There are a lot of people who take vitamin D. Vegetarians, yes, we look at B12 for other common conditions also. So we look at these micronutrients, try to give it through the thing. Unless yes, vitamin D or a supplement or a iron supplement need to be given, it needs to be given.
Thank you so much. Before we wrap up today's session, ma'am, would you like to make a comment before we wrap up? Salome, ma'am?
Yeah, thank you, Sreemathy, for this excellent session. And I think we have answered all the question, and you rightly said that it is individual approach, personalized approach, but there is a variation of accepting a different food by a different gut. So we need to understand their gut individually, and then that's what you said, we must know their body and then give. So the same, suppose same onions can trigger in one person, for another
Yes.
person it cannot. Similarly, for those who are plant-based, some patients do tolerate egg whites or
Yes.
even an egg yolk much better. To improve I think the variation or improve the protein we can include if the patient is tolerating. So gut microbiome, of course, everybody cannot do these tests and we cannot do it,
Yes.
but by different one session with this patient, two session will just not be able to achieve anything. You need to have considerable, session after session till the person feels comfortable and without having any urgency to go to the loo throughout, say, suppose the working professional day, at least throughout the day, and then the normal practice he can use it. So we need to achieve this. So you rightly said that you just can't blanketly avoid certain foods, dairy or gluten. In fact, sometimes what we are telling them to avoid are beneficial to them. So we must find out what it is. The rightly mentioned is the texture of the food. Yes, they need to cook it very well, not even a particle. Sometimes you have to mash it even like how you give to babies. In that position, sometimes I have to tell them to sieve it and then use it. And then they feel so good and energetic at the same time. So these are the variations we must include. We may feel, hey, what this adult person, how I'm giving this mashed food or a blenderized completely and sieved. But that's the way to go. So thank you, Sreemathy. I think you have covered almost all. And we will look forward to having you for the probiotic session also, so that our audience will know which strain of probiotic, strain of the bacteria good for which condition.
Sure.
So we'll
Thank you.
definitely do. Thank you so much. Thank you,
Thank you,
Richa,
ma'am.
for
Thank you,
having
Richa.
so
Thank you
much.
all
we
for it.
were in the conference today, so we just couldn't, get into it. I mean, Geeta also apologized that she couldn't
Thank you, ma'am.
join today.
No
Because
worry,
Fortunately,
it is
ma'am.
her session going on now, yeah.
Okay. Oh, sure, ma'am.
Yeah.
But
Thank
ma'am,
you
you're looking
all.
very smart.
Yeah.
You're looking very smart.
You're looking very smart, ma'am.
Thank you,
Very
thank you.
beautiful.
Thank you.
Thank you, Mr. Gandhi. Yeah. I thought you were a part of this conference, but we missed you anyway.
Yes, we missed you, ma'am.
Okay.
We missed you. Next time,
Okay.
ma'am. Okay.
Thank you,
Okay.
ma'am. Thank you, Richa. Thank you
Thank
all.
you.
Thank you
Thanks
so
for the
much. I would
opportunity.
like to extend our sincere gratitude, Sreemathy ji, for being here today, for enlightening all of us with the engaging and thought-provoking session today. We are going to be looking forward to more session from you on probiotics with your advice and ma'am's advice. And I would also like to thank the organizers, the BNA Life organizers, Nitin ji's team, Advait ji, Pius for being so actively involved, Vishaka for doing all the back end and the technical team
Yes.
for working so hard for their efforts and dedication. Cannot forget Dr. Geeta, Nazneen, who has been a part of the core committee of about planning these sessions. We are on the 47th session and we are still going very, very strong and active with all the upcoming sessions also. Now, lastly, I would like to thank all the attendees. We had a great audience numbers today. Thank you for actively participating. We're going to be looking forward to more such continued support from all of you and looking forward for connecting with you all again soon. Have a great evening. Thank you so much, Sreemathy ji,
Thank you
and all
so
of
much.
you
Thank
for being
you.
here today.
Thank you, Nitin and team, and Vishaka for coordinating. Thank you so much. Thank you, ma'am. Thank you,
Yes,
ma'am.
bye, bye. Thank you, Richa.
Bye.
Thank you,
Bye.
ma'am. Thank you. Take care.
Bye.
Thank you, Richa ma'am.
Thank you, Nitin ji.
Thank you.
Always.
Great.
Not a
Yes,
problem. You're most welcome.
it was one of the best sessions I can tell you.
Thank you.
Yes, ma'am. Thank you. Good attendance.